Welcome back to A New Me. We are here with one of this area's top plastic surgeons, Dr. David Kung. Welcome, Dr. Kung.
Thanks. Great to be back. Actually, always great to be here with you.
Oh, it's our pleasure to have you back with us.
Thank you.
Let me start right off by asking you if you can tell us what body recontouring is.
Body recontouring is basically the aesthetic way to reshape a person's body, and particularly we're talking about the abdominal section, the flank section, and the hip areas. Those are the areas where traditionally a lot of the fat tends to deposit due to genetic reasons, particularly in females, but also in guys. And body recontouring is a way to make this area look a little bit nicer. Because a lot of people, they come in, despite vigorous exercise and diet, they just can't get that last little bump or that last contour down to where they want it. And this is where body contouring comes in.
Want to trim that pouch, so to speak.
Absolutely, yeah.
Now, what is the latest technique?
Well, body recontouring, as in anything in plastic surgery, exists in a spectrum. The gold standard in body recontouring is still a procedure called an abdominoplasty or a tummy tuck with some liposuction involved. The newer techniques are now trending towards less surgery, and in fact there's a very, very new procedure that doesn't involve any cutting at all, where you can actually reduce some of the pouching and some of the fat excess.
We're now going to see Dr. Kung perform a body recontouring procedure.
Here we are in the preoperative holding area, and what I'm doing is checking and assessing where Rhonda's landmarks are going to be in order to properly place her low abdominal incision. This, by the way, is the only scar that Rhonda will have from her abdominoplasty procedure. What you see here is the actual power-assisted liposuction cannula that we will be using to aspirate the fat prior to performing the abdominoplasty. After both sides are completed, both of the flanks have been recontoured. Rhonda now has the hip and the waistline that she's always desired. This is the beginning of the abdominoplasty procedure where we're making the low abdominal incision. Okay, now the abdominal flap has been raised, and you can see the umbilical stalk that's there, and you can also see the laxity in the fascial wall. What we're going to do now is tighten the fascial wall with a plication procedure. Now this is after the fascial plication procedure has been performed. Notice how tight the anterior abdominal wall is. Now the procedure has been completed. You can see the complete new abdomen that Rhonda has with a new belly button, which is a nice hooded oval, a small low abdominal incision that's going to be imperceptible in a couple weeks, and it's going to be very, very well hidden in the bikini line. This team at Sibley is top-notch.
We're now back with Dr. Kung. That was very interesting, Dr. Kung. Basically, from what we just saw, you utilized both the liposuction and the tummy tuck techniques as far as in this body recontouring procedure that we just saw to maximize the effectiveness and the reduction of what that particular patient's looking for in their body.
Absolutely. And we'll see a little bit later in this patient's photographs. She's exactly the type of candidate for body recontouring. She takes care of herself very, very well. You can see she's got good muscle tone and good skin tone even before the surgery. But she did just have that little bit of excess skin and that little bit of bulging, where if you didn't have abdominoplasty or liposuction, you couldn't get that board flat. And now she has it, and she is ecstatic. So basically, that's what we did for her.
Yes.
Combination of the tummy tuck procedure, a little bit of cutting with a little bit of liposuction.
All right. I believe you have some before and after pictures that you'd like to show us?
Yes, we do.
Let's take a look.
On the left-hand side, you see this is the preoperative frontal view. You can see the bulging in the abdominal area, the upper abdominal area, as well as the lower abdominal area. On the right is her postoperative photograph, and you can now see her abdominal plane, or her anterior abdominal plane, is bored flat. She loves it. And the love handles are gone. So now she has a nice hip shape, and the hip that she always wanted. Incidentally, you can also see that we reshaped her belly button. She also has a smaller, cuter belly button now. And the second series of shots, again on the left, this is the right lateral view. You can see the bulging of the abdomen. On the right, you can see postoperatively her abdomen is now bored flat and in fact a little bit concave. And again, you can also get a sense that the flank area has been recontoured. This next set of photographs is the same thing from the left side, again the left being pre-surgery, the right being post-surgery, and again very, very dramatic change in the contour to the abdomen. You can also see there's really not much scarring here, which is surprising to most folks when they consider how much surgery was done. In this last set of photographs from behind, you can see on the left before surgery she was very, very what we call tubular. After surgery, you can see now she's got that curvaceous design that folks like in their figure, especially in the hip area. We've basically given her hip back and her waist back, so she's got a nice hourglass design.
There's quite a difference in those pictures, Dr. Kung. I mean, from what we just saw, you're right. A flat stomach resulted from the procedure, and from what I just saw, I also did not see any scarring at all.
You'd be surprised with properly placed scars, even though we're calling this an open procedure or a procedure where we're doing some quote cutting, you can have some very, very nice near scarless results.
Which is very impressive.
Yeah, patients love it.
And now let me ask you, who's a typical candidate for a procedure like this?
Well, like we mentioned before, a typical candidate would be a person who is motivated to change their body habitus. A person who typically exercises fairly regularly and cares about the way that they look. And that they've already tried everything that they could basically to get rid of the excess weight and the sagginess in their body area. They're awesome candidates because afterwards this is just a little bump that they need to maintain the body shape that they really, really desire.
We're now going to meet Rhonda, who's a patient of Dr. Kung's and who recently underwent a few procedures. Welcome to A New Me, Rhonda.
Hi, thank you very much. Happy to be here.
It's nice to have you with us today. Let me begin right off the bat by asking you, what did you have done?
Well, I had in short, I had an abdominoplasty, but I had a few other procedures. It was a combination of liposuction, a tummy tuck, and some type of abdominal wall reinforcement.
And why did you decide to have these procedures?
Oh, for the longest time I have been very athletic, worked out all the time, but I just couldn't get rid of that tummy. And no matter what I did, the sit-ups just weren't helping at all.
Like a number of us.
Yes, exactly.
We try, as hard as we try, sometimes it just doesn't go away.
Oh, I know. So Dr. Kung, I went to see him, and he told me that he could help me out, and that is exactly what he did.
And what was your recovery time?
Oh, geez, it was, I don't even know if it was a week, maybe a week, 10 days. But I was up and walking and doing, excuse me, normal activities, so I was pretty good.
And how do you feel about the results?
Oh, my God. I'm a different person. I have total confidence in myself. For the first time in my life, I'm a figure 8. And I never...
Very impressive.
And I never was before. I was straight up and down.
Well, I want to thank you, Rhonda, for joining us today on A New Me.
Thank you very much.
We're now back with Dr. Kung. That was very impressive as far as talking to Rhonda and hearing how she feels, and you can certainly see that she's very happy with the results, Dr. Kung.
That's right, and you can see why she's an ideal candidate for surgery.
That's right. Now, we've only got a few moments left, and I've got to ask you, and I'm sure a number of our viewers would like to know as well as myself, how safe is this procedure?
Well, as we mentioned in the video footage in the operating room that you saw earlier, it is critical in my estimation that you do this type of procedure in an accredited setting. In other words, you have to have an anesthesiologist there who is monitoring the blood loss and the fluid balance. You have to have an appropriate nursing staff who's very familiar with the way the moves are done. Short of this, I would really be careful about doing, or launching into this type of procedure. But generally speaking, it's quite safe. Folks usually only stay overnight in the hospital, maybe 1 day, and they're usually back to their normal routine and back to their normal lifestyle within 7 to 10 days.
Very good. That was certainly very informative. And on that note, I'd like to thank you, Dr. Kung, for being a guest today on A New Me.
Oh, always my pleasure.
It was our pleasure to have you with us.